Welcome back to the Pastore podcast. I know that we were on a little bit of a hiatus the past couple of weeks, but with everything going on in the world right now, you can imagine with Dr. Pastore's knowledge, he has been in incredibly high demand and just didn't have the time. He was focusing on saving people's lives, and that's way more important than doing a podcast. But we are back here today, and we are talking about celiac disease and mental health part 2. Part 1, we talked about a recent study that talked about some science connecting celiac disease with mental health. And this week we're going to get more into the recommendations for what people should do. So Dr. Pastore, if you can just fill us in on what to expect.
Awesome. I really appreciate that. And today what I'm hoping to discuss, because this area is so vast, right? When you say brain health, there's books that are 500-page long in the lay press written by well-credentialed individuals covering such a big topic and a broad topic. But I'm hoping to focus on some real important key action points and action steps that I use on a daily basis on multiple patients when I'm consulting for corporations and other groups that I know can immediately start providing some benefit and some help. And I'm also speaking directly to, I want to be all-inclusive, but also directly to my celiac disease peers, right? That's how we started part 1, was talking about this new study where there were deleterious changes in white matter for individuals that had celiac disease. And then I even mentioned during that podcast, an earlier study on gray matter. So all of our matters were messed up if you were lucky enough to have my beautiful celiac disease.
Whether you're following a gluten-free diet or not.
Yeah, exactly. Whether following a gluten-free diet or not, which is why I feel that's why I really want to reach this segment of the audience, my kin, my brethren, so we speak, right, for this disease, to talk about some of the things I've done that I can absolutely tell you have changed the way my brain works. And thank you for the kind opening. I've been working around the clock and dealing with some very difficult cases and consulting for the top players to help with rapid drug development, everything you could possibly imagine I've been involved with. And we can discuss some of the things I can discuss in a future episode. But today I really want to talk about amplifying and enhancing our brain health, particularly in the celiac disease community. But I'm happy to pepper in that it will really help everyone, the things I'm going to be discussing and talking about today.
Awesome. So in terms of brain health, for celiac disease patients, one of the common complaints that they have is that they don't feel sharp, or they're constantly in some sort of brain fog, and they're just not 100% most of the time. Now, first of all, why is that? And then what sort of tests do you recommend to see if everything's okay?
That's a great question. And I think it's right now we know it's multifactorial. Many celiac disease patients can start feeling brain fog and various neurocognitive delays or issues with regard to their cognition, and they're concerned about their brain health for multiple reasons. We determine this, and we call this multifactorial. So there's many different things that are creating these types of experiences the individuals are having. Primarily, based on our conversation in the last episode, there's this new data on structural changes that are just part and pardons for having this disease, right? The changes in white matter, the changes in gray matter from an earlier study, that's just a fact of having this disease. But we also know that's what happens with this condition. There's damage to the small intestine. It's an autoimmune disease, so it can damage the area where our villi and microvilli reside. And then since it's an autoimmune disease and you damage that area of the intestine, that can then enter other parts of the body and land and harbor in other tissues. So that's one of the main concerns in medical researchers, is tracking down all the areas of damage that can transpire just by having the disease.
And I'm sure there's lots of tests that have to be run because there's so many different reasons for it.
Yeah, the good news is I'm really going to simplify it to just like 2 big things, I promise. But the second reason, and it's one of the tests that I want to talk about today, is when you have celiac disease, you malabsorb. And it's very well known in the clinical literature. Even doctors who don't even believe what you eat has anything to do with how you feel. I still love those guys and gals, still exist. They do. So for those people, even they agree that in celiac disease, that's where you're going to find your classic nutritional deficiency. So I'll go out of order. I want to start with something, throw a curveball out there, something we have not discussed, but something that I think is awesome and that I use in clinical practice, particularly in the celiac disease patient that's, oh my goodness, Dr. Pastore, I feel brain. Can I start getting a grip on this? And I use this for reasons. So the thing that I use is actually a brain span. It's a test that started out of the United States military. And it's one of the first tests that I've ever felt so comfortable with because it looks at a combination of a couple of things. It looks at essential fatty acids and their relationship inside the cell and inflammation. And then it looks at cognitive function metrics at the same time. So what's so cool is individuals can see first their results and see where we stand, and then get an action plan of how to improve those results, and then actually get retested and track their improvements. So
And
it's really
how
kind
does
of cool.
that test work?
Yeah, it's really cool. I hope that, cool that nobody can see just my face and I'm not showing, this. I actually have a test result in front of me, and it's really neat because I use this quite often on different patients. So the first thing that it does is it's got a small little blood test that's done through a finger prick, looking at just some really small pieces of information, but very solid data. The first thing that we're looking for is something called an omega-3 index. How much EPA, a very important fish fat, and DHA are found within the cells, and exactly it's measuring the percentage of that. What's neat is there's a whole bunch of studies. There's actually 11 solid studies that I personally read that are associated with the higher the percentage of omega-3 fatty acids known as EPA and DHA. Don't want to confuse it with a different one known as ALA, which comes from vegetable sources, which again is great, but that has to be converted into EPA and DHA. And a lot of celiac disease patients don't do that because it costs nutrients to do that. And a lot of these celiac disease patients are deficient in the nutrients that run those enzyme systems to make these fats. So you want them to just get the fats. Right, get the fats directly, right? We don't want to take flax oil and turn it into what could be a fish oil. I want you to go right to the fish oil, right? We don't want to, especially when we're talking about the human brain. But what's so neat, to summarize in very brief bullet points, the summary of these 11 studies all together show that if you have a higher omega-3 index score, you have up to a 47% reduced risk of dementia. You have improved short-term memory. You have better focus, memory, and learning, and you actually have a better mood. So that's awesome. So something as simple as for me to be able to, because my work is very complicated, right? I do a lot of work in genetics and pharmacogenetics, but to be able to say to someone, I'd love to see your score around 12%. That is really easily identifiable. And then the individual goes, oh, well, I'm 3%. And I go, yeah, that's not good. So what we want to do, here's exactly how we could fix that. And then we can repeat this simple test in the comfort of your own home in several months and see where you stand. So that's just one component of this test where I get information. Another thing it'll give me that I love is a cell inflammation balance. Again, based on really solid peer-reviewed literature. So it'll give me a ratio now inside the cell of omega-6 fatty acids, specifically one known as arachidonic acid, which is very profoundly pro-inflammatory, and balance that to an anti-inflammatory fat known as EPA, one of the aforementioned fish oils. And that's something where I'd want to see a low ratio. The lower the ratio, the better. Perfect is 1-to-1. I've never seen that in my life yet. I scored really close at 2-to-1. I was really excited. So, I want to see if I get better scores while we're on this hiatus. But I've had people come back 33-to-1 or 23-to-1. And boy, there's a lot of inflammation going on. And to be able to share clinical literature with them, how this increases inflammation and this is associated with a change in cognitive functioning, again, based on real solid academic studies, is a great learning tool. Another thing it looks for is something called cellular palmitic acid level. And what's fascinating, you'll learn, Lexi, a lot of work in brain health from a medicine perspective also correlates with cardiovascular diseases. The health of the blood vessels, anti-inflammatory effects. People who have cardiovascular risk symptoms and conditions like plaquing of the arteries, of course, you could imagine, negatively impact brain health. People who have high blood pressure have a higher risk of dementia because it disrupts blood flow, et cetera, et cetera. So
and it goes beyond having a stroke. I know a lot of people think, oh, well, heart attacks and strokes are pretty much the same thing in different areas of the body. It's not just strokes. It's cognitive ability, it's memory, it's mood. It goes way beyond just getting blood flow to the brain, right?
Correct. You're so right. And then it's also just this simple thing. And keep in mind that I'm still discussing this tiny little finger prick, right? So far, this is the blood part of it. And it does talk about the brain to the body. And a lot of our work is so critical with regard to nutrient intake for the individual, right? We can give them all the results in the world, but once they leave the office, and now the virtual office, they're on their own, and you can only cross your fingers and hope for the best and coach them to the best you can and give them, positive affirmations to keep going and staying on the path. What I have found is implementing this little tool in this subset of patients that say, hey, I'm experiencing brain fog. Is there anything new and exciting that you can analyze me and try to hopefully push me in the right direction? This tool has helped me tremendously, helping people stay on course. Because one of the things I've noticed from my own academic research on what I'm talking about with regard to palmitic acid and getting how much palmitic acid percentage-wise is inside a cell is how it drastically helps normalize this substance, insulin, leptin signaling, appetite, apostatic mechanisms in a real cool, indirect neurotransmitter way. So I find that when people have higher palmitic acid and decreased leptin signaling, they have feelings of hunger, they have lower energy levels, they have a greater storage of body fat, and they're at a greater risk for metabolic syndrome. So that's a real interesting thing. And when I optimize their value, telling them what to do to fix it, they end up having, hey, I feel that's what I gave these results this morning, and there's a good number, a good score. And the patient said, hey, I felt full. Like all the distractions around me, I wanted to keep eating, and I no longer felt so hungry. So I was fighting against this individual's genes with something that is chemically found within their cell, showing them how we can enhance it, and then having the positive outcome that we desire. In addition to that, this test is so cool that it gives the patient brain games. I call them brain games, but they're exams. They're tests that are very well academically respected tests. This comes out of the United States military. The medical doctor that developed this was the executive physician for the Pentagon. This has been studied at Harvard, probably one of the top advisory board members. I think everybody who hears my voice knows, and it's the beloved Sanjay Gupta, MD, neurosurgeon from CNN. So he's one of the dudes on this board. And I've loved this test, and the results I'm getting are awesome. So what I'm measuring with this part of the test is it's a computer-based test, and you'll have them repeat it on the device that they use. I prefer a tablet, so I'll ask them to please first do it on a tablet, and you can measure their memory capacity in really interesting ways, their sustained attention. You can measure their cognitive flexibility, their processing speed, and then put that all together and give them an action plan and something that's doable. Why I need to change your diet. Because it's funny, Lexi, I could even have people come in and I could say, you're at risk for heart disease. Oh my goodness, you're hypertensive and you're sodium sensitive, and here's how we could change that. But when people come to me and say, I can't remember this person's name, where I put my keys, the passwords on my computer, something, it changes everything. I get their full attention to participate in their own healthcare and finally be a healthcare advocate. So I think this is such a cool time and an appropriate time to preach to my kin with celiac disease to do something about your brain and, see a doctor and consider one of these tests. This test is actually covered by Medicare in the United States, which is awesome. So it's a very well respected, easy to do test, even awesome during a quarantine. Your doctor can send it to your house. You can prick your finger and mail that back, and you don't have to touch anyone, wear your mask, right? And you could do all your scores online, and they all pop up into a database for your doctor, and it's turned into a PDF report for the doctor to be able to analyze and then prescribe based on the peer-reviewed literature that we see. So that's the first main big test, and I think it's really exciting and something new. We haven't talked about it before. I don't see enough doctors talking about it, but I've seen them do it in piecemeal. I know a lot of
about it. Like with my concussion history and everything going on, I feel like that would have been awesome to help out with.
Well, yeah, and it's what I'm thinking about right now. And believe it or not, in your case, don't want to push you in any way. I know, we have a beautiful friendship and working relationship, and I don't want to force practice on you, but I think it would be a really cool thing. We respectfully ask that you let me make the assessment, though, because
that'd be awesome.
I'm well trained in this area. Yeah, and it's really a dynamite test. It's extremely cost effective. And as I said, with the prescription, doctors can, there's definitely a reimbursement. I think one of my patients out of pocket paid like $15 or $20 or something like that. So a great little tool, and something that's also highly reproducible in a set environment. So if someone took it on their iPad with the updated software for the computer part, you can have them just repeat that on the same device. And don't now go to your Windows, slow to boot computer. No, I'm not throwing stones at Windows. I'm saying don't switch to a slower model and then do the same test. You keep that standardized, And then we do our little finger prick and measure the actual percentages of these key fatty ratios that all the top research institutions are looking at. And it's why all the doctors are saying, eat more of this, right? So what I'm saying to you is coming from a very authoritative perspective, all the peer-reviewed published literature, but it's so neat that you're getting it in piecemeal. Like even Harvard Health newsletter is saying, fish is brain food. And in my mind, I'm like, only if it's inside your cells, right? So, is it getting in there? So it's really important to do those things and get more information. I said I was going to break it apart to only 2 tests. The second thing that I do is just a long battery of all those aforementioned nutrition deficiencies, those nutrient deficiencies. And thankfully, because you and I just seem to work a lot, we have a lot of podcasts and we have a whole entire episode covering all of that. So I won't be redundant except to say people who have my disease are at risk for deficiency of vitamin A, vitamin D, vitamin E, vitamin K, folic acid, B6, B12, calcium, copper, magnesium, zinc, selenium, iron, and the aforementioned omega-3 fatty acids.
So, all of the vitamins and minerals that you can think of, celiacs might be deficient in.
Yeah, isn't that great? God, we're a healthy group.
In terms of those podcast episodes, we have a full podcast on common nutritional deficiencies specifically for celiac patients, and then we have a full common nutritional deficiencies for the non-celiac section of the population as well. So
ooh, that's right. I don't know if you need a brain span. That was really good. I just went, oh yeah, that's right. We did do that. So that was a good one. Yeah, no. So those are really the 2 main things that I focus on from that perspective of testing. So that's neat. And it just truncates it down into like a soundbite of what you can do.
And speaking of previous podcasts, there was another one that we did that talked about high blood sugar and insulin and how it can lead to Alzheimer's that might be the new type 3 diabetes. Yeah. So how does that connect in with the celiac and mental health topic?
And boy, does it. So for patients who have celiac disease, there is a definite hand-in-hand connection between type 1 diabetes, which is the form of diabetes where you don't have the cells in the pancreas that produce enough insulin. So you end up requiring insulin. And in type 2, of course, you still are making enough insulin, but your cells are just resistant to it. So in both instances, we have risk factors in celiac disease for both those cases of diabetes, which is lovely. So what we want to do is be even more vigilant about focusing on our sugar and our insulin control. And this is something, of course, that can be measured. I'm trying to simplify our dialogue. And I'm going to give a great tool because I'm sure everyone did this at home and you could run to your own medical records before going back and hopefully listening to this prior podcast episode, as Lexi says, and you could immediately find out where you are on the scale, the risk of scale. So what do we want to do? We want to understand that there's a risk factor. Diabetes raises the risk of heart disease and stroke, of course, as we know, but it absolutely impacts our blood vessels in our brain, which decreases how well our brain will function. And studies have shown that you can negatively affect white and gray matter with poor circulation. And we are already, as celiac disease patients, at a disadvantage with this data coming out with MRIs, showing we already potentially have those problems. So why throw salt on an open wound? Let's really address this and be aggressive about trying to control our blood sugar and our insulin levels by eating a low glycemic index diet, low glycemic load diet. But then you may say, well, hold on a second, Dr. Pastore, you say everybody reacts to food differently. Well, that's why I'm going to help you out here, speed up the problem. And there's a biological marker that can help you understand your risk. What you should do is first see if you have any fasting triglyceride test from your doctor's office and your fasting glucose test on your last doctor's visit. And then there's an algorithm, and I promise I'll give the exact formula, but there's these little calculators online that could do this math for you. There's a logarithmic math scale that can tell you your triglyceride to glucose index that can predict your risk of insulin resistance. And if your score is in the risk zone, you really should look at the carbohydrates you're eating, your total intake of sugar, and really sit down with a professional.
Gluten-free or not. It doesn't matter if they're gluten containing or not. Carbohydrates, if you have too much of them or too much carbohydrates, they're going to raise your blood sugar and throw off those levels.
You got it. And look, in general, and I know you agree with me here, Lexi, no matter what anyone's philosophy is about nutrition, in general, the walking group of the population is consuming way too much carbohydrates. So if you're a living human being breathing and getting around in life, you're really overeating carbohydrates. You don't even know how much you're overeating until you sit down with a nutritional professional and you go, oh my goodness. And in some cases, some people are under eating them. And I understand that's a completely different topic. And especially when I'm working with professional athletes and training athletes, it's a completely different conversation when I'm having this talk with an NBA player. Okay. And even then I see prediabetes risks and I have to still truncate what they're having. But when you have like a guy who collects tolls at a toll booth that's eating, 500, 600 grams of carbohydrates a day and has no exercise.
Processed sugar.
Yeah, exactly. Exactly, which is why please go back and listen to that episode about, the glycemic index, glycemic load, glycemic scale. And yes, we discuss, the weaknesses therein, but it's so important to understand what a carbohydrate is. But let's discuss this math. So people if you run your calculator, logarithm of fasting triglycerides, which would be measured in milligrams per deciliter, times fasting glucose divided by 2, people with an index of 4.9 are greater, they have a greater likelihood of having insulin resistance or being at the risk. And then that would compound what we're talking about right now on the past episode and this current episode of really harming your brain health and putting you on a path towards early onset age-related mental decline. And again, being celiac, I'm already at this disadvantage. And if you're listening and you have celiac disease, it's important to practice and understand where you stand on this scale. So the name of the scale is called the triglyceride glucose index. It's a really dynamite scale that's getting way, way more attention in medical literature. It's fast, it's easy, and in this time where you cannot go outside and see your physician right now, you could at least pull out your old data, run it through a simple calculator, and see what's my risk. So that would be a real neat one to do.
And if you don't have copies of that data, call up your physician and say, hey, can you email, fax it, write it down, ask for it, because they're going to have it on your file.
They are. And you know what's sad, Lexi, is in every incident where I ask for it for a patient that I'm seeing, everyone has been either positive, where I had to get it, or they were very close to being positive. And then they embarrass their practitioner and go back to them and say, oh my God, look at this, I'm 5.6 or something like really astronomically high, and they're at a greater risk for having insulin resistance. And when you really examine them and you start looking into their risk factors, they clearly are on that path towards insulin resistance or have it right now. And there's so much that can be done to mitigate that risk. And again, please understand, it's not just a pathway towards diabetes. It's a pathway towards, of course, decline in cognitive functioning that's associated with diabetes, which then increases all-cause mortality, particularly from cardiovascular disease. So these are real simple, actionable steps that you could be doing right now while you're at home.
So let's get into specific types of foods and nutrients that people can be eating day to day, whether they're low glycemic index or just generally great for you, high in omegas. Yeah. What can people do to eat every single day to ensure that they're doing as much as they can for their brain?
I love this question. And I'm going to start with something that you and I love so much. And I'm so happy watching my daughter just pummel this area. And these are berries. I know that everyone will say, well, I know they're just good for me, but what do they specifically do in the brain? I can tell you that Harvard actually did a clinical trial on these, and they found that just 2 servings a week, Lexi, of strawberries and blueberries delayed memory decline by 2.5 years. That's awesome. So that's like, keep in mind, they did nothing else. They didn't say, let's fix your insulin resistance. Are you deficient in vitamin D? How's your omega-3s? No, here, I know you're doing nothing. Just have some berries. So to me, that's like a superfood. There's 400 beneficial positive chemicals found in various berries, proanthocyanidins, various types of chemicals that get that pigment change. If it's natural and can stain your clothing, you should be eating it. And the berries really are in that category of just being a superfood and get into the brain. So blueberries are something that I believe if you can, you should eat them every day. At least something in the berry family. If you have an allergy, there's other pigment-rich vegetables that would fit in very similar categories. Please seek them out. Believe it or not, there's some dynamite data on coffee and tea. And I know there's 2 parts to this, as you're aware. There's the beneficial components to coffee and tea. They're both rich in antioxidants, which are beneficial to our brain. But there's one of my favorite things on it, and there's caffeine. So Hopkins Big fan of Johns Hopkins. And what they discovered was if you just give an individual the equivalent of caffeine to a cup of coffee, and of course we did this in coffees, and I helped work on some coffee trials throughout Miami. But Hopkins did this cool study where if they gave you the equivalent to 1 cup of coffee worth of caffeine versus a placebo, the next day you had better memory recall of the information they were trying to have you learn. So if you had a placebo and you were asked to memorize these specific outlay of dominoes and these names and the way these shapes work and their colors, you did great if you had the caffeine. If you had a placebo, you did not do as well the following day. Now, so that what we've learned is caffeine can actually cause retention and memory.
Would this scale though, like is there a specific range of caffeine people should stay in, not more is better?
Well, and that's a real tough question because it's a definitely individual thing. I do look at caffeine markers and how well an individual processes caffeine across the different alleles. And I am aware that individuals that may have different alleles, and I know we did a podcast on this too, by the way.
Yep.
So cool. Of individuals have a terrible genetic marker. And I feel bad for those of you that do have that. And I'm mentioning this, but they actually have an attenuation in performance. It typically is physical performance. But they can have actual reduction. So like if they're got a bad genome for this and they're pounding a Red Bull, they could have a reduction in performance that's in the double digits of percentages. And the last time I looked at the data, it was like a 12.3%, but you can get as high as 7.8% improvement if you're like a double A allele carrier for CYP1A2 for utilization of caffeine. It's just one of the interesting markers. So to answer your question, it really depends on the genetic allele. Someone who's really dynamite in processing caffeine, I happen to be one of those people. I have a minimum of 3 cups a day. When I was working on some trials in Florida, we actually found a subset of the population and went as high, close to 10 cups. I'm not recommending that. I'm just saying we did it just because we wanted to see, hey, I talked to Dr. Peacock and he was using astronomical values of protein. That's how we learn as scientists, right? We want to know what could be the threshold of tolerance and what could we learn. And it's exciting information. So we did find, believe it or not, on the higher group, the group that consumed more than 3 cups a day of coffee, they had a delayed risk factor for Parkinson's disease, Alzheimer's disease, negative impacts in their brain. And I really don't believe that was definitely just the caffeine because we have a limit to how much caffeine we can consume. In the pregnancy years, I'm a big fan when women are carrying to just try to stay away from it. As soon as they're done weaning off breastfeeding and lactation has ceased, I ask them to start slowly because they reset all their adenosine receptors. And I say to them, and this is a perfect example, let's set our target as no higher than 200 milligrams. And then let's just see how your body responds. Because you get it from different sources, right? Dark chocolate is such a great food for the brain and it's really healthy as an antioxidant. But that's also adding some caffeine. And then you may have 2 or 3 cups of black tea, which while it's not a high caffeine source, it will add up. And then, of course, throwing a Starbucks on top of that, and it's like, boom.
Or an espresso shot or whatever else you're getting.
Exactly.
To keep yourself
it
awake.
all adds up. Yeah, so you really want to be careful because you have too much, of course, you could feel terrible. And I think that's one cool thing about what Hopkins did. It was the equivalent of just 1 cup of coffee, and it showed that you could have such drastic improvement. So I think that's a really neat thing. Needless to say, there's a lot of great studies on omega-3 fatty acids, but I'll mention 2. One from the plant-based group UCLA in my neck of the woods back in 2015. They had a really neat study that showed higher walnut consumption improved cognitive test scores. And that's because walnuts are rich in alpha-linolenic acid. Alpha-linolenic acid is converted into eicosapentaenoic acid, better known as EPA. And then directly from fish, my goodness, there's an enormous amount of studies, but I'm trying to think of ones that you may not be aware of. There's actually a study that you can reduce beta amyloid plaque production, which is kind of like grease on a spark plug, and it just kind of shortens things out. Or if I dipped one end of a toaster plug in Elmer's glue, it's really going to be lame and may not even fire the circuit to turn on the toaster. So that's what can happen in our brain. The higher our intake of these omega-3 fatty acids into a beneficial ratio range, as I discussed with the brain span test, the lower the amount of beta amyloid that we're seeing so far in studies. So those are really neat actionable steps that you could have. We did cover this pretty in depth when a study came out on choline. I still can't believe how hard it is to get people to consume enough choline, but it's so important. So about 8% of Americans are getting the adequate amount of choline.
AKA 92% of you are not.
Yeah. So, it's a battle. So I'll be honest, I have to jump to supplementation here because I'm afraid that you're just not getting it, and it's way too important of a nutrient. It's involved in every aspect of cognitive functioning. It's critical for normal myelination, which is where the white matter is so strong, and us celiac disease patients really have to make sure we hold on to that. Reducing inflammation within the brain, and I could really go on for about an hour just on choline. But here's the problem. An adult male such as myself, I need 450 milligrams a day, and I don't eat beef liver. So 3 ounces of beef liver will give me 357 milligrams of choline, and we hope that's what's in the beef liver in my kitchen. The United States database did not test the exact beef liver from the cow that is in my house, so that's another challenge. I don't consume that. Luckily, I do consume eggs, but you're only going to get it in the yolk. And there's a lot of people that don't have all the yolks for so many different reasons, right? You want to get more of the protein. Some people may feel they're cholesterol sensitive. That doesn't matter. The point is not everyone's doing it. And while an egg yolk can be fantastic, there's 147 milligrams of choline. Well, a woman that's pregnant or in lactation, they need 550 milligrams.
So that's like 6 eggs a day.
Yeah. So I'm just like, just jump right to, please, let's get a supplement. Try to eat the wonderful foods that contain choline. I always give my patients a list. I know we talked about it when we did that prior episode, but if you're brave, you're braver than me. Beef liver, eggs that contain the yolks, chicken breast will give you 72 milligrams. But again, look how low that is. That's like what, 13%? Codfish, ground beef, all in the 70s. Broccoli will give you 31 milligrams. Cauliflower, half a cup, 24 milligrams. Yes, it all adds up. But guess what? You know, I'm also talking to my demographic, my people, and us celiac disease patients, especially if I'm talking to the newly diagnosed, you're not absorbing that well. So you're really not going to get the full bang of the buck that you're seeing on the USDA database, which is where I got the information I'm discussing with you all now. So I've never felt comfortable with that. I do have some scar tissue in my small intestine, and I take a choline supplement every day. I actually take 2. I'm an extremely massive fan of an ingredient called citicoline by a company that's called Kiowa Pharmaceuticals. It actually was a drug for a period of time, but this is a natural, safe, FDA-approved, over-the-counter dietary supplement. It's known as cognizin. And the amount of studies on that and the benefits of the choline that is contained therein are really getting longer and longer and longer. There's a new one coming out on memory that I'm so excited when that's published. Lexi and I will talk about that. There's studies on increasing adenosine triphosphate cellular energy in the brain up to 18%, 26% increase in healthy brain membranes. Well, isn't that everything we talked about that starts to get broken down on our last episode? We talked about white matter and the connectivity and the membrane importance and the integrity of the membranes. All that suffers when you have celiac disease. So I could tell you it's quite interesting. And I'm not a placebo guy, and I prescribed it and recommended it. But what I'm getting my data from is actually putting patients on it, obviously from the peer-reviewed clinical literature, but putting patients on it and then having them go through MRIs and come out and seeing the improvements. So you're not only hearing them tell you the improvements, but it's measurable.
And that's extremely exciting. Backed.
Yeah, it's scientifically backed, and that's huge. And I will just go out on the record and say you have to take enough of it. So if you're going to experiment into the pool of citicoline, please don't pick up a can of an energy drink that contains 25 milligrams. You'd need a lot of those energy drinks, and then you're going to hate me because you're going to be vibrating. You need around 500 milligrams a day of citicoline to really feel cognizant, to really feel those beneficial effects. I've always believed in the prescription doses because that's what they used in the clinical trials. And those are the ones that work so well. And I'm not ashamed to admit that my favorite form of how I'm taking cognizant every day is in a product called Power On that I really love.
Me too.
I do. I really love it. I mean, look, I'm a 50-year-old father. I chase a 2.5-year-old around, right? It keeps my brain healthy. I honestly, Lexi, so what I did, we talk about personal experiences. I just said, you know what I'm going to do? I'm just not going to take it for a little bit. Just wanted to just give it a whirl, And again, I'm not a placebo guy. Today was my first dose back, and I feel like I'm exploding out of my chair and I need to be strapped in. My brain has just been 1,000 miles an hour. And I love that. And it shows that in a very short period of time, it can have that effect on word recall, scientific, from the way my brain works is just reaching scientific information. It helps it work, my brain work more like a textbook. And when it's not there, I have to go digging into PubMed, and there's nothing wrong with that. But it's cool when I can just remember it and have it right in my arsenal.
For me, I woke up this morning after we talked about this before the podcast. I stayed up until 2 o'clock in the morning last night, binge watching Netflix. Woke up this morning and just like wasn't really feeling doing much. So I didn't take my power on because I take it before I sit down at my computer. And those 2 hours just kind of went by very, very blandly, and I was not awake. Like, it took me a long time to wake up, even after getting breakfast in me and drinking enough water. It wasn't until I took that power on, I was like, okay, time to go sit down and do my work, that I felt like I was mentally there.
And it's so great you said that, because one of the studies that was done was literally on attention performance in healthy adult women. Women are better brain processors than men. Okay, that's just a fact. It's a given. Incredible organizational skill sets. They're amazing at processing, and that's why you're so great at what you do. Imagine you on enough acetylcholine based on the studies. So that's really what you were doing. The results have been there, and I love the data sets that are on there. And what's cool is I could tell a brain span test patient that's on acetylcholine versus one who is not. It's amazing. Their reaction time is crazy. Even if I have to fix other things, I actually said to this patient this morning, you broke the test. Like, it's like you should score a 12 and you were like a 15. Holy cow. So it was just awesome how quickly they were able to access data. It's really neat thing. Yeah, definitely a neat thing.
With the brain games that we were talking about, is that one thing that you recommend? For me personally, trying to recover from my concussions, I'm taking my power on and my choline, but I'm also using the Luminosity app just to do those memory games and like try and recall things. And when I started, call it 3 months ago, my stats were so low and these games were difficult. And they still are. They progressively get better the more that you do them, and they continue to challenge you. But what sort of other things can people do to enhance their brain function?
That's awesome. I just want to say that I love what you're doing. I applaud it, and I prescribe them. So please keep doing those games. For the older age group, the people in my AARP category, they have great brain games to members, for members, that I recommend, and they're free with your membership, and it's awesome. They're by the same category, and they're made by neuroscientists. So Luminosity is awesome. Please keep doing that. So what else can we do? And this always makes me laugh because of being a dad. I want to slap myself when I talk about sleep, but I do sleep really well. So I should. There's times you don't, right? When you're a parent. But I'm just going to name one study because we could talk for way too long on sleep. There was a study back in the journal Sleep, which is the clinical definitive journal. Short sleep duration was associated with worse markers of white matter integrity in midlife. So I'm talking to you, celiac disease patients who have risk for white matter degradation. Do everything you possibly can within the normal elements of your life and the limitations therein to try as hard as you can to get the sleep you can, particularly if you're middle-aged, right? So I think it's so urgent. These midlife differences in white matter can underlie risk factors that are associated with not just cognitive decline, but the bad stuff, dementia and stroke. So I wanted to just try to pick out like a home run study that will get everybody listening and hopefully just trying to do whatever they can to improve their sleep. For me, I take something called Power Off because I can't sometimes turn my brain off. I'm very focused on my patients and their various biological matter, and I have to try to tie it all together and solve puzzles. So for me, I need a little bit of help. I'm not ashamed to admit it. And natural dietary supplement called Power Off that really helps calm down my brain, and I really do get wonderful sleep. I've been sleep mapping and tracking myself, and I'm clocking in at just over 7 hours every night, which is a very beneficial thing. Because I went through that whole, my daughter's not sleeping, and that's not fun. Something that's near and dear to my heart that everyone should be doing, and hopefully something you love, but something that's difficult, is taking a class.
Especially learning now with quarantine and everyone being home. Use this time.
Please use this time. I'm actually sad that I'm not back in a university environment. I just found a new study on making new biologic drugs that they have at the University of Wisconsin, and I want to sign up for it, but I know my wife would slap me in the back of the head because I've spent my whole entire adult life in university. But I love it, and I'm so passionate about it, and I love when it's new and challenging. So learning leads to rapid microstructural changes in white and gray matter. And that's, again, staying on topic. I'm not going to give you a soundbite that doesn't pertain to the topic at hand. This is real, but here's how it's real. If you're learning something that you already are proficient in, that's an oxymoron. You're not learning. So if you're really awesome at knitting scarves, don't start knitting scarves again in class. Take something completely different and alien to you. So using MRIs, what did researchers do? After learning something that is one, complex information, multiple steps. Oh, I have to do all these things to get there. Awesome. That's called complex, right? And then, or performing a complex task. Because remember, using your limbs is extremely important. Using the dexterity of your fingers. That's so important. Learning a new, very difficult exercise form changes your brain. So if Lexi were to prescribe an extremely difficult position that she knows the comfort will come getting you in that position, but it's the right position, she's helping your brain. So listen to her. Okay? Okay. So just doing that, like, okay, and let's say that's too hard for you. How about learning a computer language or a foreign language or, something you don't speak? That would be really awesome too. But it's so important to learn. And the very last thing I would mention, and there's a whole separate study on this that I think is very exciting, and it's unbelievably appropriate. It's a year to the date. It came out in the journal Nutrients in April of 2019, and the title is awesome. It's From Probiotics to Psychobiotics, Live Beneficial Bacteria Which Act on the Brain-Gut Axis. That's the title of the study, and it was published, as I said, a year ago this month. And I've been giving out that study to patients and showing them a picture of how important it is to make sure they're caring for their microbiome, eating really healthy, removing dietary insults, consuming dietary fiber, which acts as a prebiotic to feed the good guys. And if warranted for your case and you see a professional and they recommend a probiotic with cause, you should try that. And it can actually drastically help how you produce neurotransmitters. And we have a whole podcast on neurotransmitters and all the beautiful things they do. But they help with the cell communication that can start to become a little bit lame if you suffer from changes in white matter, which can happen with celiac disease diagnosis. So those are really my main thing I ask everyone to do.
So try and get a brain scan if possible. They will deliver it to your door. Also get some blood work to see if you have any nutritional deficiencies. Monitor your blood sugar and your insulin to make sure everything there is in check. Eat healthy foods, berries, caffeine, choline, probiotics, get some sleep, and learn. And
Yes.
That is the entire episode summarized in one very long list.
That is awesome. You nailed it.
We thank you guys for tuning in and listening and being patient with the couple weeks that we had off, but we are going to be back again next week with a very interesting on-trend topic. We will be talking about COVID-19 and everything that's going on and the information that Dr. Pastore has. So be sure to check it out next Friday, which will be April the 10th. And we will see you back here then on the Pastore podcast.
Thank you so much for listening.